Okay.
Right, live.
We'll go live.
Hello, everyone. I think we have a couple of attendees who've joined us so far. So we'll give it a couple of minutes. You are in the right place. You're at the West Midlands Health and Wellbeing Innovation Network Discovery Session. Thanks very much for joining us. For those of you who have joined us already, we will just wait a little while, just as we ordinarily have, a little bit of buffer with these events where people are finishing up their workday and/or finishing up whatever they need to do. So I would say talk amongst yourselves, but this is actually a live broadcast session that we have today. So it's just ourselves and the presenters that we have that are able to actually interact. But we do have a live Q&A function. So if you have got any questions, please feel free to drop them in the Q&A section, and we'll be happy to answer them at the end when we have a good chunk of time dedicated to Q&A. So we'll just give it a couple more minutes, just while we wait for a few more attendees to arrive. Okay. And we'll start at around 35 minutes past. Now, for those of you who have joined us, we are live from the Innovation Centre at University of Warwick. We've got a very intricate setup of various cameras, lights, monitors and displays. This is our first half hybrid event where we're broadcasting essentially to you all. So please bear with us. We're really trying to push into the new world of hybrid. That is proving to be relatively challenging. There's lots of equipment needed to be able to do a half hybrid live broadcast. So if we do have any technical issues, I'm sure that you'll understand that we're innovators over here, and we're pushing the boundaries and trying to do anything new that we can. So we'll just leave it another minute or so until 35 minutes past, and then we shall kick off.
And just did you mention Josh will be recording this? So I don't think we'll be able to actually see people's faces or names if you've joined us as an attendee, just the presenters, but we will be recording it for others to be able to watch at a later date. Yeah,
absolutely. So if you do post a question, that question is selected and we refer back to that, then that may well be spoken about as part of the live recording. Otherwise, it should just be us and the questions that you send. Okay, so it is 35 minutes past 3, so we're going to make a start. Hopefully we'll have some more attendees drop in as we go through the event, but we won't recover any of the old ground because we haven't had anybody new drop in the time period that we have just been discussing with you. So to those of you who are here, welcome again to the West Midlands Health and Wellbeing Innovation Network Discovery Session. Thanks very much for joining us promptly. It's really exciting to be here. Like I mentioned, we're here in the Junction building at the University of Warwick, where our Health and Wellbeing Innovation Network incubator will be based, and we'll have the attendees and participants will have the opportunity to use the facilities here, as well as the multiple facilities of the partner organisations that we've got available. So really exciting to be here and sharing with you today some of the information about the programme. I'll just take you quickly through the agenda that we have for the session today. So we'll be doing our welcome and our introductions and waiting for people to drop in as they do in this first 10 minutes or so. And then I'd like to hand to Wendy, who is the Operations Director for the Innovation Group at the University of Warwick here, who will talk a little bit about the origin and the vision for the West Midlands Health and Wellbeing Innovation Network. Then we'll hand to Lucy Gilbert, who's the Innovation Manager for the University Hospitals Coventry and Warwickshire, who will talk a bit about the innovation overview, how they approach innovation at University Hospital Coventry and Warwickshire. And then I will talk about the programme specifics and the approach. So hopefully that will provide some more information to the businesses that are planning on attending and participating in the programme. And finally, we'll hand to Anna Madan, who's the Serendip Manager at Bruntwood SciTech, who will tell us a little bit about the Serendip programme overall and how potentially that could feed into this programme. And as I said, finally, we have a really good chunk of time for Q&A at the end. So any businesses that are on the session and who have got questions about the programme and what they would like to do, have the opportunity to ask us those questions. So that's our session for today. Without further ado, I'm going to hand over to Wendy Coy, who is right here next to me in the studio. Who's going to tell you a little bit more about the vision.
Thanks, Josh. Okay, so I think it's important just to set a bit of a scene as to how we came to be where we are currently. So we had a look a while ago at what the West Midlands might need post-COVID, and we felt that there was a real undercurrent of need for the region to develop, not only in getting its health economy back on its feet, but also in getting the economy back on its feet too post-COVID. So we had a look at what the sort of assets we had across the region might be, who might be interested in helping us do that. And we found some willing partners to look at setting up a pilot study. So a starter, if you like, a proof of concept phase for us as an innovation network to prove that an innovation network actually can meet some local health economy needs and also develop the economy through finding commercial products and projects and services that can meet real health needs. So we put together some proposals and got our willing partners of UHCW and Bruntwood SciTech together, along with our very excellent Warwick Medical School and other departments within the university who are very keen to engage in the network. And we put a proposal to the West Midlands Combined Authority, who thought actually this is a very good idea and that they would like to start the funding process for us. So their main objective really, I guess, in funding the programme is to attract businesses or to develop business in the region. And again, that's about developing the health economy. But it's not just about developing new businesses, it's about looking at businesses that already exist and scaling those or adapting them to meet the challenges connected with health. UHCW are a fantastic partner. They're our partner organisation, or one of our partners for the medical school in the training of doctors. We also do a lot of research with them too, and have some shared staff across there. But they're also, in this particular instance, the indicator of what challenges are being faced, and more about that later. And Bruntwood SciTech are helping us with the Serendip model, and again, more about that later. And collectively, we're pooling the resources and the networks that we have to make this a really successful programme. So it's designed with the core team, as in us, the people who are going to be speaking today in the centre, but there are a number of other people that we're engaging. We're not competing with them, we're trying to add to the network, and we're trying to utilise the skills, experience and people that we've got access to and relationships with to make these things happen. So wider NHS organisation and healthcare trusts across the West Midlands, not just in Coventry and Warwickshire, but the aim is that this will ultimately, after our proof of concept phase, go across the whole of the West Midlands. So we're engaging with the LEPs, with all of the academic institutions across the patch, with Public Health England and a variety of others. And there's also an existing network of networks, if you like, that exists. So we've got the Academic Health Sciences Network, who also look at innovation within the health sector as innovation within the NHS as well in terms of NHS X, and a whole variety of others that we have been engaging with. So the idea, as I say, is to make sure that we're not duplicating, but we're adding to the existing structures and processes. One of the joys of being an academic institution and having partners like this is that we don't need to take anything out of anybody's ideas. We're here to add, to mentor, to coach, to add our expertise, to access the wide range of brilliant minds that exist within the university, but also the brilliant minds of the students that are coming through and who want to engage and deliver in the academic and innovation space as well. So why did we create it? Well, we have such a joy of life science institutions, of exciting projects on board, but also there is a real need within the region. The health sector, as is evident whenever you turn on the news, it needs to have some more help, it needs to have more support. It can't solve all of its own problems, it needs other people to help to solve those. But by focusing on the real problems within health sector, we are able to provide solutions and guide innovators to the right place. So a solution without a problem isn't really a solution, and a problem without a solution will exist for years and years to come. And the people who own the problems and the challenges aren't the best people necessarily to solve those problems. So focusing on those challenges and aligning them with business that exists, business that nearly exists, business that could be pivoted and supported to exist in that space is a real joy place to be. And that's why we're encouraging businesses from across the region to join our cohort, where there is no cost. All you get is support, all you get is nurturing, all you get is access and networking. Why wouldn't you? To be honest, why wouldn't you? So we're building on those strengths in the region, the resources, the knowledge, the networks, and absolutely to accelerate the innovation that we have. So our vision long term is that it becomes a much bigger thing. It is across the whole of the West Midlands, and that each of our businesses that we help to accelerate or incubate can have access to investment opportunities. So we have relationships with investors and with venture capitalists and with venture networks and angel networks. And so trying to get that traction to enable businesses to prove their concept, to get their proof of concept within our programme, will give them the opportunity to get further into the NHS procurement processes. Because you could almost guarantee that if an idea works in one acute, it won't be the only acute hospital in the world that has that issue currently. There's clearly opportunity to scale in those areas. It's also opportunity to work with our academics on a research basis, as well as on a problem-solving basis. Okay, and so I will now hand over directly to Lucy, I think. So Lucy, it's over to you for the UHCW bit.
Lovely, thank you, Wendy. So I'm Lucy. Can you hear me now? Fab. So I'm Lucy. I'm the innovation lead here at University Hospitals Coventry and Warwickshire. I've just realised I don't have control of the slides, so can somebody click forward for me, please? So I'm just going to talk to you a little bit about what we do here at UHCW, our approach to innovation, why innovation is important to us, and some of the challenges that we face around in the innovation team that this network will support us to overcome. I can't move the slides on. Is somebody able to move those on for me? Thank you. So why is innovation important to the NHS then? So we all know with the long-term plan that was published in the last few years, there's a real big push and a real big drive in order to adopt innovation and to change the way we do things. We also have publications such as the Greener NHS, which says that NHS has to reduce their carbon emissions by around about 80% within the next couple of years. So huge challenges facing the NHS. Next slide, please. Sorry, I'm a little bit lost because my slides were slightly changed. Other challenges around the NHS. So at the moment, we're really facing that workforce challenge as well. So our workforce from the past 18 months are exhausted. Our workforce are increasingly having to work harder and work differently. So we need to support our workforce in order to support them to meet the sustained pressures facing the NHS at the moment. We also know the NHS somewhat lags behind other industries in terms of adoption of technology and innovation. What's new and innovative in some areas is not new or innovative to the NHS. So here at UHCW, we have visions as a trust to really be at the forefront of both idea generation and creativity within healthcare, but also to be at the forefront of adoption of innovation as well. So the trust has invested in a standalone innovation team. So we are a very small team at the moment, but a very ambitious team as well. And we're housed over here in the Innovation Hub at UHCW. So a few years ago, the top floor of the library here was converted into a large open plan space, which is set up to really facilitate creative thinking, collaborative working, idea generation, etc. Next slide, please. Okay, so anybody who's tried to innovate within the NHS will be extremely familiar with these challenges. So when it comes to other industries, other companies, they know that in order to be innovative, we need to be creative. We need to push the boundaries. Innovation always needs some pump priming of funds. We always need some investment. Innovation is a lengthy process. So I think the usually quoted time is around 7 years for an idea to get through from conception all the way through to commercialization and implementation. Within innovation, failure is very much encouraged. We like to look at challenges. Companies that are good at innovating are comfortable with uncertainty and taking risks. But we all know within the NHS, the exact opposite applies to almost all of those. So the NHS are very much, rightly so, very focused on having an evidence base, very much focused on seeing immediate results. We're all familiar that the NHS doesn't have many surplus funds lying around in order to invest in potentially risky innovations. So as an innovation team, as anybody working with innovation in the health sector, we constantly find ourselves trying to tread that balance between what you need in order to innovate, but also some of the constraints around what it's like to operate within the NHS. Next slide, please. There we go, just to illustrate that. So how do we try and approach this as an innovation team then? How do we try to walk this tightrope, if you like? Well, here at UHCW, we've got a very well-defined pipeline of innovation that takes ideas through from inception, through to sketching, through to prototyping, through to development. We have to be very creative when it comes to approaches to funding and collaboration, which is why we were really keen to get involved in this network as a new way of doing things, new way of looking at things in order to bring in and import innovation into the NHS. Whilst we never quite know what's going to come and land in our inbox or walk through our doors from day to day, we do have very clear links within our team strategy towards organisational strategy. So even though we don't know what's going to come to us next, we can decide whether it's something we want to invest time and resource into, depending on how well that links into the organisational strategy. We also have a very clear definition of innovation. So I think lots of different people define innovation as different things. Within the trust, we've got a very large, very active research and development department as well. So R&D do lots of innovative research, and we've had to be very clear about where the line is drawn between what is research, but actually what is innovation. And innovation kind of comes in at the first point when you're thinking about that idea generation. Then you have the research that looks, is this valid? Does this work? Is this effective? And then innovation comes in at the end to really implement innovation as well. And then other key things we do just around kind of networking. So I say innovation happens when the stars align. So that's why we have Serendip. That's why Serendip's called what it is. So innovation is very serendipitous. And the more highly networked we are, the more likely we're going to be able to match a challenge with a solution, or be able to work with the solution and adapt that into our challenges. Next slide, please. Okay, so what do we actually do here as an innovation team? So we've got an awful lot of work to do within the trust to raise awareness just within the trust about what we do as a team, because we are still new, so we're still doing some work to get established as a team. We do a lot of work around developing the innovation community. Like Wendy was saying, there's an awful lot of talent, an awful number of highly skilled and very knowledgeable people within the West Midlands, and we really want to link into them. Well, we do link into that and really support the building of those networks. As I said, we do a lot of work on pushing forward those innovation ideas. Innovation adoption, so we work very closely with a lot of the networks, get a lot of referrals in for innovations at various stages of development that we can either support, signpost or adopt. And then that fifth bubble of what we do is really around challenge definition and horizon scanning. And I think this was something fairly new for the team. As I was saying, the team here at UHCW has only been established a couple of years. I've only been in post since the beginning of this year. And to date, we've been waiting for kind of ideas and innovation to come to us. And now we're very much saying to staff, come to us with your challenges, come to us with your frustrations, and we will work with you to find solutions to those challenges. We have our double diamond approach to innovation, which is kind of pushed by the Design Council in the UK, and we'll really work to understand that challenge, understand the context of the challenge, really define it and refine it, and then go and seek lots of potential solutions, and then work on one of those solutions to make sure we design it and adapt it to the context to make sure that we can implement but also sustain that solution as well. So this challenge definition and horizon scanning is where we're really excited to work closely with the network, and working with them to help us to define those challenges and find some potential solutions out there for that. Okay, and so that's me.
Fantastic, thanks very much, Lucy. So we've got just one slide here at the end, and you finished on a really perfect point actually about the challenges, because we've obviously done a lot of work through the development of this programme to develop the challenges that we would like to focus on for the West Midlands Health and Wellbeing Innovation Network, and through your work with stakeholders at UHCW, we've settled on the 4 key sort of challenge areas. So at this point, I'd just like to open up the room a little bit to have a discussion about the importance of these challenges to UHCW, and perhaps some more of the detail about some of them as well. So shall we start with the first challenge, waste management? It might seem like it's a relatively trivial thing, and where is the innovation that could actually be achieved within waste management? But actually, from working with the stakeholders at UHCW, it's very clear that there is a really high impact on patient outcomes if waste isn't managed properly across the hospital and across the trust. I don't know if you have any detail to add with that, Lucy, just to kind of put a bit of colour on it.
Absolutely. Okay, so yeah, go into innovation, work in innovation, they said. It will be glamorous, they said, and we're doing an awful lot of work at the moment around waste management and tracking of waste and segregation of waste around the trust. So there's kind of two aspects. There's the patient safety side of things around waste management, and there's also the financial challenge and the financial gains around optimised waste management as well. So as a trust, there are various different types of waste that we collect around the trust. Disposal of those waste streams vary between the different waste streams. So if we can get better at segregating that waste, we can potentially make some financial savings to make sure we're sending away only that specific type of waste rather than that waste being combined with other types of waste, which cost us more money to dispose of. We also, and obviously this also links in with the sustainability challenges and the sustainability targets that we have to meet as a trust as well. But then very specifically within waste management as well is a real challenge around sharps bins. So we use a returnable system of sharps bins across the trust. So our bins come into the trust, they're filled up, they're shipped back out to the trust, they're emptied, they're washed, and they're brought back into the trust. However, that's a very labour intensive process at the moment. We actually have one member of the portering team that walks the floors of the hospital for several hours each day, collecting those waste bins and returning new waste bins to the organisation. And he's got he's been doing this role for a number of years. He's got really good personal knowledge in his own mind about which wards use more bins, which wards use fewer bins. But obviously every day can be different, and there may be times where he walks up to a ward and they've suddenly put out all their sharps bins that are full for collection. And he's not got enough sharps bins on him to replace that. So we can easily run into a situation where a clinical area is without a sharps bin. When that is the case, and there has been cases over recent months where clinical areas can ring up and go, we've had to stop all clinical procedures involving sharps because we've got no way to safely dispose of these sharps bins, which obviously you can then get that time delay where they have to ring through the site team, and the site team have to source a new sharps bin and bring it over to the ward area. So it sounds like something very small, something fairly inconsequential when you go, well, you're looking after patients and you're making sure that patients are well while you're focusing on waste. But actually it's one of those things that need to be running very, very efficiently in the background in order to not disrupt patient care. So one of those things, if you're doing it well, you won't notice it. But where the process goes wrong or could be improved, you really do start to notice it.
Fantastic. Yeah, and so you can see just scratching the surface of something as seemingly simple as sharps bins. Actually, there's many layers of complexity to it, and it does have a real impact on how the hospital functions and how the trust functions. There's a really complex supply chain behind the management of waste, and specifically sharps bins. So just moving on to the next challenge then, moving people and equipment. I know that there's a very specific trust scenario here where we have multiple sites across Coventry and in Rugby, where we need to solve a very specific local geographic challenge of moving people and equipment from one site to the other. Could you tell us a little bit more about that, Lucy?
Absolutely. So we, as a trust, we have two sites. So we have the main hospital site here in Walsgrave, and then we have a smaller site based over in Rugby. Often Rugby do lots and lots of operations over on that site, not as much operations as we do here at the Walsgrave site. But there are instances where we have a surgery list of the day over in Rugby, and there are times when that surgery, the clinician or the team involved realise that there's a device or something that they need, an implant for the patient that is over in Walsgrave and then very quickly needs to be shipped over to Rugby. So we need some kind of very fast demand-led transport solutions. Again, transport solutions which are more sustainable, are very, very much preferred for the trust in order to meet our sustainability targets. We also collect a lot of pathology samples and blood samples over in Rugby as well, which need to be transported back over to our Walsgrave site in order for the lab to process those. And at the moment, these are batched together in order to wait for road transport to arrive and take it back over to Coventry. And if there's a way of getting supplies from one place to the other without having to batch them, without having to wait for a minibus by road, we'd be very interested in hearing about that as well. But then also on the equipment, so obviously as a large acute trust or as any hospital, we've got some high value equipment that we need to be available at the right time for the right patient in the right place. And often some of this equipment is fairly thin on the ground, or we might need it and not quite know where to find it. And sometimes this equipment leaves the site as well, so it may go home with a patient, and at some point we need to bring that equipment back onto site as well. And at the moment, it would be good if we could improve that process of that equipment tracking. So the key one for us at the moment is around syringe drivers, which obviously are vital for patients who are on a palliative care pathway. And it is imperative that these syringe drivers are available when we need them for the patients we need and to be where the patients are at. And if we could just have better visibility of where these devices are, it means we can support our patients, get the medication into the patients that they need in order to relieve their symptoms.
Great, thanks Lucy. Just really helps us to get the detail around each of these challenges, so that any businesses that are planning on solving this challenge for you and for UHCW have got the opportunity to tailor their application process and also their pitch, if they're successful, to be able to meet some of those specific criteria. So just in the interest of time, we'll move on to the next two. And talk quickly about patient flow. It's a massive challenge that I think a lot of trusts are looking to solve. So there may well be certain components of the challenge that we're looking to solve specifically as part of the programme with UHCW here, but certainly a challenge area that I think a lot of businesses will be able to get their teeth into and help to make some change in. If I could hand to you to perhaps put a little bit more UHCW colour on it.
Fantastic, thank you, Josh. And I'm glad you said that, because I was going to combine them both together as well. So patient flow, patient state and visibility, all very apt at the moment as we kind of finalise our winter plans and our winter pressure plans. So anybody who's been in A&E or anybody who's been an inpatient in a hospital will be able to kind of understand these challenges. So if you've been in a hospital, especially if you've been an inpatient, if you're waiting for ward round, if you're waiting for the clinician to come along and the consultant to come along and have a chat with you, or you know you're going to have a blood test, but you're not quite sure when they're going to come along and do your blood test, or you're waiting for some occupational therapy to come up and have a chat with you and have some therapy. When you're an inpatient on a ward, you know these things are going to happen today, but you might not know when they're going to happen. So patients will often be sitting at their bedside going, well, is now the right time for me to go and grab a coffee and ring my family, or am I going to miss the consultant when he comes? And we know there's quite a high level of anxiety in our patients about just not quite knowing what's going to be happening next. Also for anybody that's been to A&E, you can appreciate that frustration and that's anxiety around, well, how long am I waiting here? Where am I in the queue? What's going to happen next? If they've told me I'm going to have an x-ray, but then what happens after the x-ray? And it would be really, really valuable for our patients if we're able to produce a tool or produce some kind of digital app or digital solution which just makes that pathway and where they are in their pathway a little bit more visible, so patients are a bit more aware about, okay, this is where I am now and this is what to expect next as well. So there's the patient side of things, but then there's also the staff and the site management side of things as well. So we obviously, as all trusts, as all hospitals are, very keen to get people out of A&E as quickly as possible into the ward if they're being admitted. However, we know there are often delays in handover on getting people from A&E to the ward. At the moment, it's a very paper-based process. It's also reliant on the ward receiving a phone call or an in-person visit from a member of staff in order to alert them that a patient is on their way. Our KPO team, which looks after the lean methodology and making processes a lot more lean and efficient, did some work a couple of years ago on the patient flow problem, and they found an awful lot of time was spent trying to ring through to the wards, waiting for wards to be answered, taking a patient up to wards and then having to wait a long time for a staff member on the ward to be available to actually accept that patient and do that handover. And if we could make this process more efficient, if we could alert wards for a patient to receive a patient in a much more efficient way, it would save an awful lot of resource and really optimise that flow and allow us to push patients through the system and push patients through the pathways a lot more efficiently.
Fantastic, thanks very much, Lucy. Really great detail around all of the challenges that we've set for this first cohort of the West Midlands Health and Wellbeing Innovation Programme, and hopefully that's really useful to all of the businesses that are in attendance and all might be listening to this retrospectively, and will help you to tailor your pitch to us to join the programme. So, just moving on. I would like to take some time to tell you a little bit about how the programme will actually be structured and some of the nuances of the approach to the programme, and how we will essentially create value for the businesses that join, but also for the stakeholders at UHCW, for the interfaces with some of the research and resources that we have available here at the University of Warwick. And then I'll hand over to Anna to talk a little bit about Serendip. So firstly, I'd like to explain about the demand-led innovation approach that we've spoken about a few times, and that Lucy's provided us a lot of detail around with the challenges. So any good innovation ecosystem needs a flow of resource. So that could be funding, it could be expertise, and it's really essential to make sure that the smaller businesses that we're looking to engage as part of this programme have got value and can see value for their participation, and it makes sure that at its core there's that value exchange is built into the network, and in this programme the value exchange is essentially the access to expertise who are future and potential customers of the solution that you develop or how you iterate your solution as part of the programme. So even just on the introductory webinar here with Lucy today, you've gained so much more detail about each of those challenges that may well be help you to tailor your pitch and or tailor your solution. Throughout the programme you'll get the opportunity to work with people who have got that domain knowledge, such as Lucy and from across the hospital, and also people who are experts in the product development process and how you can actually apply that knowledge and insight to tailor your solution. And it basically means that we can be really lean with how we approach and minimise waste for the businesses that come onto the programme, and make sure that they're really laser focused on the problem and the solution fit, and that we can also maximise that problem and solution fit, so that ultimately that potential of becoming a supplier to solve that challenge is maximised. But in big ecosystems like the NHS, as Lucy mentioned in some of her slides, the problem solution fit is potentially slightly more complex to be a simple value exchange of one to the next. So this might look a bit of a complicated slide, but if you take the University Hospital Coventry in Warwickshire as an example, and some of the challenges that Lucy and I just discussed, there are multiple components that need to be considered in each of those solution spaces. So, for example, in the waste management challenge that we were talking about, it might have seemed simple, but there are at least 3 different stages that we need to consider in the journey of waste through hospitals. and multiple stakeholders as well that we need to consider, such as the porter who is working at the helm and moving the sharps bins and the waste around the hospital, as well as the ops teams that are managing where that person can and should be at any one time. And this means that each challenge will potentially have a solution space where there could be multiple solutions that will contribute towards solving that challenge. And that's really been our approach in terms of scouting for solutions that solve these challenges so far. And I'd like to take you through how that might look in a little bit more detail. So for any business that is thinking about applying for the programme, I really need you to consider this approach as a core aspect of how you come into this programme. Because for each challenge we could be looking for businesses that have that direct problem solution fit, as we can see on the left hand side just here, but it could be that there are already existing solutions that have been procured by the NHS, or could be other participants that come onto the programme that you need to collaborate with to be able to fully solve the component of the challenge that you're looking at solving. And this is really fundamental to the approach of the innovation network part of this programme, because it's a platform and ecosystem based approach to innovation, which basically ensures that we find the right solution and implement it at the right level, and the right knowledge and expertise are brought in to be able to do that. And it provides the businesses that come onto the programme with that testing ground to make sure that their systems can technically interact with other systems. And when I say technically interact, I mean from a technical perspective, aka you have the APIs to be able to share data from one feed to another, and interact. And that's a key requirement, I think, for what we're looking at going forward, both within the programme interaction and then also with the existing systems as well. So just to bring that to life just a little bit, I'd like to show you an example, again coming back to that waste management, the first challenge that we have of how a solution space might look. So at the bottom of that solution, we will need sensor systems that can gather data potentially and establish whether a sharps bin is full, and that could be based on weight or the level of sharps that are in, or other sensible data that we can, and when I say sensible data that we can censor, as opposed to sensible data. And then that information, though, in silo doesn't actually solve the challenge, just gathering it. And a business that typically focus on developing sensor systems is usually great at developing hardware and hardware design, but the management and build of the data dashboards, for example, is quite often a very different skill set. So that data needs to be transferred into an operational response dashboard, that needs to be really well designed for ease of use. So for those people who are guiding the porters where to go in the hospital, and or monitoring for future changes that need to be made, and needs to even take into account things like the multiple devices and the different types of users. And that complexity is part of the system, and it needs to be managed by a business that has got the expertise in that area. At the third level, at the reporting level, it may well be that we need to work with a company that has got knowledge and expertise in AI and machine learning, that can build models from that data that we've already gathered, that we can then extrapolate and use going forward to say, okay, actually there's this specific part of the hospital that is overusing sharps. What can we do as a hospital to be able to reduce their overuse of them, and so that will actually then feed into an overall improvement of the system, and ultimately that then needs to feed into any systems that the NHS and that the hospital uses to be able to then share that with third parties, such as the company that actually monitors and maintains their facilities on site. So that's just a real world example of some of the different components to what seems on the surface quite a simple challenge, and how we may well be looking for multiple solutions to be able to actually solve it in cohesion. And that does directly feed into the selection criteria of the programme as well, because that willingness and capability to collaborate with others, not only the NHS and the expertise that you have access to from there, and with our programme partners at Serendip and Bruntwood SciTech and University of Warwick, but also with each other, because we will most likely be finding solutions that may well need to hand off data from one to another. So coming in with an open innovation mindset into this program is really key, and that's something that we'll be looking for your, not only your willingness to be involved in, but also your technical capability at doing as well. So do you have an API? Have you ever worked with solutions that can that have an API before and subsume some of those data sets? The second criteria is around problem solution fit. So as we've mentioned previously, this is a demand-led and a challenge-led program. So those challenges that have been set with the stakeholders at UHCW are specific, and we're looking at solving those. Whilst we're open to the idea that a solution may exist that we don't already know, to a problem or challenge that we don't already know, and we wouldn't like to shut that down necessarily. We would like to select on the basis of problem solution fit to make sure that the resources that we have available as part of the programme and at UHCW have a direct impact, not only to the businesses that are involved, but also the hospital and ultimately patient care. And then the final criteria is around business stability and the ability to be procured as well. So we'll be looking at, for example, what level you are with your funding, whether you've previously had access to business support, whether you've previously had access to seed and the various funding streams that you can get access to through venture capital, but also through any innovation grants or UKRI competitions as well. And then the team structure, so the having the team in place to be able to deliver upon some of the things that need to be delivered. Having said that, that is something that we can help with throughout the programme, because we think that the businesses that are potentially coming onto this programme may well be a bit more mature than early stage startups and might have slightly different challenges to very early stage startups, such as scaling up teams to be able to do that, continuous improvement and responding to challenges such as this, which is a big challenge that any company faces. So that's something that we'll be embedding into the programme and that we'll be able to help you with too. So I'd like to take you through the structure of the programme as it stands. However, there may be some adaptation to this on the basis of the cohort that we get. And the deadline is the 27th of September, so please bear that in mind, any businesses who are on the programme. So we're looking at doing a first phase, which is very much our discovery phase, building on what we're talking about here, but much more in-depth research, working with the participants on the programme. We'll also be doing some work on the methods and techniques that we'll use as part of the programme, so the innovation and product development techniques that we'll be looking to use, such as Agile, and how to be customer centric and embed that into a programme such as this, and how to prototype and measure success. So really critically, we'll be looking at key KPIs and measurements in that second week in our 2-day bootcamp, where we'll set some targets for ourselves that we can measure the success towards the end of the programme. From that point, we'll actually go into much more of a research phase where we do stakeholder interviews with some of the people who are involved with the solution at the hospital end, as well as some customer research as well, if there are patients and users involved. And from there, we'll have the data that we need to be able to make an MVP or a prototype development plan that will take us into the next phase of the programme. So this next phase is prototyping and incubation. So by this point, we will know a lot more about you as a business and about the businesses that are on the programme. So we'll be able to tailor some of this to some of your needs. But really, on a week-by-week basis, the prototyping stream will be check-ins with key challenge managers and stakeholders from across the network of resources that you've got available as part of the West Midlands Health and Innovation Programme, to monitor how you will actually move through and develop your prototype. And we'll be working to a plan to be able to do that. And then alongside that, there'll be a series of complementary sessions that will enable you to, if you have a challenge, for example, around protecting intellectual property in an open way, which again is really key to this, we'll run sessions around that, business modelling and partnerships, and all of the different things that a business might be looking for at this point in their journey as they're scaling. And there may well be more sessions that we add into this as we start to learn who you are and what the businesses need from the programme. And then the third phase is really around data and demonstration. So we should by this point have a prototype. If that's a lo-fi prototype and something that is just demonstrative at this point, then that's fine, but we'll be aiming to get a customer test of some type done within this programme, at which point we'll be able to actually take some data and analytics and insight, even if that is extrapolated from data models that we can use from things like the model hospital. We'll be bringing that all together to then prepare a presentation for the midpoint, which will go back to the challenge managers and sponsors from across the network, and we'll be able to then advise whether the business needs to make a pivot. Actually, if we've kind of chased something and the solution has become not something that we necessarily want or need, or has become overinflated, it's got feature bloat or something, we'll be able to advise on that. Whether actually if it meets quite a lot of the criteria, but we just need to do some more testing to gather a more comprehensive data set as to whether or not this solution actually works, or whether actually we've got really good strong data points on whether the solution works, and we need to just be looking at improving the solution and adding new features into that if it's relevant. And then finally at week 19 it'll culminate in final presentations where we will be able to assess the final outputs of all of the work that has been undertaken as part of the programme. So that is the programme in a nutshell. Hopefully for any of the businesses that are attending, that are planning on coming along, it'll give you an indicator as to the level of involvement that you'll need, and roughly we'll be able to have a conversation offline about any resource capacity and those kinds of things, but hopefully it'll give you an idea as to the resource. So at that point I'd like to hand over to Anna to talk a little bit more about Serendip and some of the work that they've been doing adjacent to the West Midlands Health and Wellbeing Innovation Network that could feed in and act as useful resources for any businesses who are planning on coming along.
Thank you, Josh. Lovely to hear about these challenges we didn't come across so far, and the workflow of the program looks amazing, so look forward to it. Hello everyone, my name is Anna and I'm the Incubator Accelerator Business Manager for Bruntwood SciTech at Innovation Birmingham. Bruntwood SciTech is a joint venture between Bruntwood and Legal and General, and we are based around UK in many regions such as Manchester, Leeds, Birmingham, Liverpool, Alderley Park and Cambridge. I am here today to walk you through our Serendip program. Serendip is a program that combines many challenges from different industries such as construction, property, finance, music, gaming, environment, you name it. It's all about technology, innovation and people. Serendip Health Smart City Incubator, as we like to name it, is an area that is a part of West Midlands Academic Health Science Network and ourselves, Bruntwood SciTech, that specializes in development and delivering of new digital innovations. It's a physical space in which all industries, academia and health and social care providers can co-design and in real-world space that allows for sharing, learnings and networking on those fantastic moments when individuals meet and share their ideas and develop their business concepts. This allows us to support and accelerate the growth of the startups that are passionate about addressing the challenges faced by the health and social care economy. Serendip Health is a program which was originally founded by NHS for 3 years already to really bring high potential and promising startups, technological, biotech and healthcare startups from West Midlands region. Within the NHS potential investors, probably one of the famous things that Serendip is known for is the investment vehicle and hospitals, clinic which invested convertible notes into healthcare startups. We also organize investor showcases twice a year, where we connect regional and external investors with our startups. At Serendip Healthcare, we have a range of mentors who helps companies to matchmake key clinics, hospitals, key investors, rather than just teaching them about how to do business, and rather than just themselves find information online. They really are the key connectors that helps the companies and make all the difference here in our campus. From the creation of Serendip, we have over 120 companies that went through the program, quite a few in a prominent media and raised investment as the result of acceleration in West Midlands. We are really proud of them. Some are still renting an office space here, so they are still in the ecosystem, in the campus, the Innovation Birmingham. Some of other ones have moved on the bigger office space around West Midlands, but we are all in a big networking community. So I'm here today to share all this information with you, as there are a lot of other startups. They're not aware with the work we are doing here and the potential opportunities and support they can gain through our Serendip program. So I look forward to join your challenges and to come with all the business support we have here, and to connect our existing companies with the new starters. That's all for me.
Fantastic, thanks very much, Anna. Yeah, it's really great to have the Bruntwood SciTech team as part of the wider network, because there's such a wealth of experience in the network that you have, and you're very experienced at incubating and building businesses. So any requirements that the businesses that come onto the program may have will be catered for across the network of providers that we've got in the network. So yeah, it's fantastic. And you've also done significant work as well with the Academic Health Science Network, and there is potential opportunities to partner with some of the program activities that are happening there. And something that I forgot to mention actually when I was doing my part, and hasn't come out, is that across this network, whilst we're talking about the resources that you've got available, we're also curating a network of mentors as well that will be dedicated network of mentors that will be screening and matchmaking any businesses who come onto the program with. Some really high profile people have already applied to be mentors who are very senior in the NHS and at UHCW, and who have really strong knowledge bases of how to implement systems and innovation systems as well at the trust. And then in addition to that, we also have an entrepreneur in residence as well, who is part of the programme, who has a very impressive portfolio of companies that he runs within the health tech sector. So he's unfortunately not able to be with us today, but he is a core team member and part of the team here at University of Warwick, and employed by University of Warwick to support the businesses as they come through. And he's got all of the scars to prove trying to sell his solutions across and into the health tech sector. So he'll also be able to act as a dedicated resource that will help to overcome any hurdles or blockers or barriers that you might come up against, but also identify opportunities and help to maximise those as well. So that concludes the speaking parts of the session that we have today. So thank you very much to all of our network partners for coming along and talking to us about the programme and your involvement. Really very much appreciate that. We've allowed a significant chunk of time here for Q&A, because really part of what we wanted to achieve with this session is to give businesses who are planning on attending the opportunity to ask any questions about how it might work for them, and also for how for any concerns that they might have, that we can hopefully alleviate. So we have a few questions that we've had come in as we've been having discussions with some of the businesses that we've been scouting for. But please, if you have got a question at this point, feel free to drop it into the live event Q&A, and we will answer that. So I'll kick off with one of the first questions, which has cropped up quite frequently actually, and it's my business is a very early stage startup. Can I apply for the programme? I'll take that question to start off with in terms of how I intend to run the programme as the programme manager, but then I'd like to open it up to the other participants as well. We are looking in principle for businesses who have got some kind of validation of their product within the health tech sector. That may well be that they have done some initial customer research. It may well be that the product isn't completely ready for market, but we are looking for an actual solution that can be implemented, because ultimately what we're looking to do with this programme is create real world impact for the stakeholders over at UHCW, but then also for patients as well. And we think that the businesses that are a little bit later stage, perhaps at the scale-up stage, may or looking to pivot into the healthcare sector, having proven their success in another sector previously, may well have more success at achieving some of those aims. And so, yes, it's the answer. You can certainly apply as an early stage startup, but if all you have is an idea at this point, perfectly welcome to submit that idea, and we'll work with you over the course of however we can to help you to get that idea validated. But it may well be that the programme itself isn't necessarily for you.
But just to add in there, within the University of Warwick, we do have a range of access to resources that you can access that might help you in that early phase of building a business or building a product or service. And a lot of those, most of those in fact, are free programmes that you can access. So do get onto the Warwick Innovation District web pages and have a look if that is the case.
Josh. Excellent. I don't know if anyone else has got anything to add from UHCW or Bruntwood.
So I think I agree with you there, Josh. Absolutely, and I think just to add that here at UHCW we appreciate how hard it can be to access the NHS sometimes, and we very much want to kind of open the doors to the NHS. So very keen, even if, like Josh says, this programme's perhaps not for you, we'd be very keen as well to support you where you can elsewhere and signpost you to places elsewhere to develop your idea. And I think also just to add, we're also very keen to support local as well. So whilst this programme is open up nationally, we are also very keen to hear from any kind of local companies as part of our anchor organisation work. Very, very keen to support local where we can.
Fantastic. Yeah, that's definitely something that we're looking for. After all, this is an ecosystem and an innovation network, and ultimately the best innovation ecosystems and networks have got that resource exchange in a locality. We would very much like to support any businesses who are potentially looking to scale out of other locations as well, to establish a node within the West Midlands, whether that be at Bruntwood SciTech or at the innovation hub here in the Climb, which we are based in today. That would be fantastic, and so please don't feel that there's any geographic constraints, because we can always work with you to overcome some of those. And West Midlands is a really vibrant network of health tech, and any businesses who are watching this who aren't currently based in the West Midlands, I highly recommend that you explore the opportunities here and explore whether or not you would be interested in setting up a node of your business here too. So we've got another question that has come up relatively frequently, and something that is definitely worth addressing, and that's is there any funding associated to this programme? So it's I'll take that question initially, and then if anybody else wants to chip in with that, then please feel free. But it's a very good question, and there are lots of different models with accelerators and innovation networks that do have funding associated to it. But quite often what I find is that creates a value exchange that is very much a customer supplier mindset, and it can quite often reduce the levels of collaboration that are involved in that program. And I've seen it happen in numerous programs in itself. There is funding for the resource that is around this program, and hopefully you've seen throughout the webinar that there's an abundance of resource that's available. And one of the key value exchanges that I see is really that access to expertise, and specifically the expertise of the stakeholders at the hospital and within the NHS. Whilst it may not be that you can knock on their door on a daily basis to validate your solution, you'll certainly get the opportunity to discuss with them how your solution can fit. And that's one of the key value exchanges that I see. I don't know if anyone else has got anything to add on the funding question.
So I'd only add that whilst we don't have hard cash, we do signpost to where there are grants that might be available. We can help in pitching. We can help you to pitch for funding from angel investors and other organisations who may have some cash. Yeah, so we can help you in signposting, even if we don't have any money of our own.
Absolutely, yeah. The University of Warwick has got a really active investment arm called Minerva and affiliates. So there's again a wealth of expertise with access to those kinds of things. And of course, being a research substitute, we can also enter into grants and bids and all of the fun stuff that comes out of UKRI as well. I don't know if anything to add from Bruntwood or from UHCW. Okay, perfect. I'll move on to the last question that we have currently. Please, if any attendees have got any questions, then please feel free to post those here. But yeah, the last one is, do I have to base myself at the Warwick Innovation Hub? And the answer to that, I think we've answered, is no, but it's definitely encouraged to have some resource available in the West Midlands to be able to manage the relationships in the programme. And I think this is one of the core tenets of the Serendip programme, Anna, from Bruntwood SciTech, that the managing director speaks about quite frequently, David Hardman, is that actually that serendipity of being in the same space as another business is really a high value thing. And certainly something that, as we've opened the innovation space up gradually off the back of COVID, we've noticed the benefit of here at University of Warwick. And there is really an abundance of space resource available to help that serendipity to happen as part of this programme at UHCW, the Innovation Hub there, here at University of Warwick, and of course the facilities at Bruntwood SciTech as well.
I think to add to that, the additional benefits of actually coming into the hub are, we don't just run through the University one hub, we also have a deep tech incubator that's looking at AI, machine learning, those kinds of things, and we also have a creative and digital incubator, and so the joy that you can get from putting those sorts of people together in a room and coming up with a different solution perhaps than the one you first started with, or people with additional skills, or different parts of that chain that Josh described earlier in terms of actually having different component parts to a solution. You have access and you're able to talk to people from those kinds of places as well. So I think whilst you don't have to base yourself here, we'd like to see you quite often, because we think that's where the magic will happen. Definitely.
Great. Don't know if there's anything to add from Bruntwood or UHCW there. Anna, you're still on mute at the moment, sorry. Okay, you're live. Yeah, I think we have you.
Do you hear me now? Sorry. Yeah, you do. So to add to that is like we are always open. So if you are looking for an office space or if you are looking just for a space, you can have your presence here with us. So our doors are open to you. So if you want to change your environment, please feel free to come across Innovation Birmingham to join our events, our business support, and you can be here to have a hot desk or to take part of the existing cohort that we already have from NHS side on health tech. Also, we have 5G on board with us. The headquarters is here, so it's a good collaboration we have with the existing companies from healthcare. So some of them they are in the process of testing and embedding the 5G into their product they try to develop. So it's another opportunity for you. It's like to explore from 5G partners as they are running their own accelerators, and they have the mini laboratory where you can actually test your and prototype your product. Another part with early stage businesses, we have a range of different programs where you can, like EFOF is designed for early stage businesses from different industries. A mixture of industry, again, is like a range of business support, one-to-one surgeries, and some innovation vouchers and that you can apply for. So there are small funds that you can apply to, and also we help you to participate to different competitions where you can win small grants or you can pitch to investors. So yeah, that's from Bruntwood.
Fantastic, thanks very much, Anna. Yeah, it's again great to know the resources that are available, and hopefully this has given participants on the webinar today the flavour of everything that's available to them, not only from the programme but also from the West Midlands. I did notice that you unmuted yourself at one point as well, Lucy. So
thanks, Josh. Well spotted. Just to reiterate as well, so as I said, the UHCW innovation team are really geared up to open the door to the NHS. So we have our hub space here as well. So we'd expect anybody working with the network to be able to drop into the hub, work here. We sit separate from the hospital site, but it's hospital building, but we're still on site. So we kind of can provide that ready access to clinicians as well.
Fantastic. Yeah, really a plethora of things that we have available as part of this programme. I needed to get the word plethora in there. So we haven't had any additional questions in. Let me just double check, but it doesn't look like it. With that, then I'll move to closing the session. If there are any additional questions that do crop up in any of the attendees' minds after the session, then please feel free to reach out to us. All of the contact details are on the web pages that are on the Warwick Innovation District website. And we'll also send around a thank you to all the participants as well, with some details through Eventbrite, with some details about the programme following this session. So again, thank you very much to the participants, thank you very much to our speakers and our network, and if there's nothing else, I'll close the session.
That's great, thanks.
Thank you.
Thanks everyone.